Are you able to scan it with your camera? Let's see if it works. It should take you to a link. Is it working? If it's working, say hi. Okay. There are questions there's a question, and you have 2 words to fill in there for those of you who've already accessed the link. We want to get a sense of your feeling about the morning sessions. So in 2 words, please share with us what your impressions are of the morning session. Once you do that and you click send, it should come up on the screen. Okay. Empowering, inspiring session, energizing, illuminating, eye-opening, nice, good, rich, wonderful, engaging, great, fantastic, brilliant, spectacular. All right. Well, thank you very much. We just wanted to get a sense. I hope you are not just being nice. This is a co-created event. We're also trying to improve on it. So if there are things that you think we can do better, please do not hesitate to let us know. We will not take it personal if you have anything critical to say. You know, it's just to improve it and get it better. But thank you. I'm quite happy that you felt that the sessions in the morning have gone very well. So now we have to finish strong for the day. We have 3 things to do, but before we do that, let me invite Mr. Demola Adeko, who is leading or helping to coordinate our engagement on social media, to share with you a few things that we'd like you to do. Demola.
Hi, everyone. Good afternoon. I was expecting, you guys have had lunch now. Yeah, so let your voice go up. So yeah, good afternoon, guys. Basically, I'm just going to talk about a few things that we would expect from the participants. Basically, this is part of our plans to create, an awareness that would evoke. Of course, we've done that already, but during the course of this conference itself, we'll be leveraging your social media platforms, your Twitter, your Facebook, your Instagram, so as to scale up our engagement on social media. As a matter of fact, currently now, the CPHIA 2022 hashtag is currently trending on Twitter. So you can give yourself a round of applause. I want to expressly show my gratitude on behalf of the entire team, for everyone who has continued to engage. I still expect that we show up the engagement and then the next few hours, and of course subsequently after today. So you have your curated messages, you have your opinions, you have your submissions, your thoughts. You can put them on social media, and of course, very, very important that you have these hashtags. These are the 3 official hashtags for this conference: YPC 2022, CPHI 2022, and hashtag AU Bingwa. I'm sure the Bingwas from East Africa are here in the house. Bingwa! 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 Yeah, those are my people. So yeah, these are the hashtags, that you include in your tweets, your Facebook posts, and your Instagram. You have the Twitter accounts that you're expected to tag, the AU Bingo account, the GIZ African Union. These are partners that are making the whole thing happen. We have Africa CDC, we have MasterCard Foundation, and of course the official handle of the conference itself, CPHIA underscore Africa CDC. So in order for you to get the spellings properly, you can take a picture on the screen so that you don't have any misspellings. That said, one other activity that we would like us to embark on now, please bring out your phones. Bring out your phones. I would want each and everyone to take a selfie of themselves or a selfie of the people sitting close to them. Then you can post on your social medias, of course, with the hashtags. So can we quickly do that now in just about 30 seconds? So take a selfie with the person sitting close to you and post on your social media. Include the hashtags. You can also tag the AUBGO account so that we can also amplify your messaging. So if there's nothing else, I think that should be all for now. Thank you.
All right, thank you very much. As you do that, before we close today, we would also take our own Oscar wannabe group selfie from the podium. All right. Technical, are we set? Thank you. Distinguished participants, this afternoon, we will be starting this session. Okay, I see people are still taking their selfies. Thank you for doing that. Don't forget to follow the accounts. Good. This afternoon, we will be looking at issues of climate change and health. Perhaps the two most critical issues that faces our world today. Global warming, as it used to be called, and of course, the issue of health. What are the intersections? How do they impact our world? What is the role for young people in addressing this challenge that we face in our world today? And to speak to us in a TEDx-style talk for 10 minutes is Sohaila El-Deep, the Director of Global Outreach and Relations Director for Zero Hour, a campaign, a mass movement that deals with issues relating to these topics. She is joining us from San Francisco, and I have to say this to her. 2 days ago, when we were trying to get tickets for her, our ticket came to $3,000, and there was no way we could afford it. So we wrote back to her to say, Sohaila, unfortunately, we would have loved to have you, but it's difficult to pay $3,000 to bring you for this. She said, no, I will join by the connection virtually. I said, but the timing. She said she would be available, and she's been on for more than 2 hours staying for this session. So this is the kind of commitment. There are many of us who are doing this in our everyday life. Sohaila is the one on the screen today, but we must continue to do that. It is not only when we are physically present. We have to use all the technologies at our disposal to let our voices, to put our voices on the global stage in places like this, so that together we can address the challenges that we collectively face. Without wasting much of your time, Sohaila, the floor is yours.
biggest threats to community health as well as health security worldwide, and that is climate change. Even knowing that the single biggest health concern facing humanity is climate change, government response is still underperforming in terms of prevention and preparation for the contagious linkages between climate change and health security. So the terrible health effects of this summer's, for example, weather extremes, which have ravaged nations all over the world, have contributed to a greater understanding of the many ways that environmental change and climate change affect human health worldwide. For example, the rise in extreme weather occurrences is just one example, and then we'll be talking a little bit about other important variables that stand out. So we're talking about extreme weather events like, for example, heat waves, floods, droughts, and much more frequent intensity as a result of climate change. We've seen overwhelming evidence of such. The weather extremes can have a terrible effect on people's health and well-being, and extreme weather events can have a serious health consequence, even when they're not fatal. For example, heat strokes, heart conditions, lung problems brought on by smoke from wildfires, and food and waterborne illnesses brought on by tainted waters, toxic bacteria, and viruses all account for these illnesses. Global hunger, for example, is being exacerbated by climate change. Rising temperatures, changing rainfall patterns, and the greater frequency of extreme weather events undermine the four pillars of security: availability, affordability, quality, and sustainability. Food insecurity alone affects over 50 million people, and those are the same people that are at risk of starvation. Disastrous situations all around the world, and then even more so in Africa, is one illustration of how global warming directly affects all of these threats, including food insecurity. More than 30 million people are suffering from hunger in the region, which is dealing with one of the worst droughts in decades and one of the biggest food crises in the last decade. The effects of food insecurity on health is substantial. The World Health Organization, for example, estimates that undernutrition is a contributing factor in about 50% of deaths among children. And malnutrition affects physical and mental development and raises the risk of illnesses, even if it's not life-threatening. And when we look at other threats, for example, climate change accelerates the emergence or transmission of dangerous infectious diseases, as we've seen with COVID-19. And this leads to displacement of people from their homes, resulting in injuries, illnesses, and a lack of access to our healthcare systems. And it poses a threat to population health security. It also increases the frequency, duration, and intensity of public health emergencies. Inequalities and dangers to human health that already exist can be made worse by climate change, which can have particularly dire consequences and repercussions for disadvantaged groups. Climate change has an impact on every sector of our healthcare industry, so both the availability and the quality of healthcare are hampered by global warming. It may cause significant financial losses for systems that deliver healthcare. Additionally, climate change makes already existing disparities in health and medical care worse. How? Well, let's look at the costs. Healthcare costs rise as a result of climate change. For example, air pollution, which each year damages the health of millions of individuals, causes healthcare systems that are responsible for caring for these people to experience acute repercussions, as well as to make it harder to get a hold of essential drugs or medical equipment. Again, we don't have to look far for the consequences. We've seen it with COVID-19 on how an infectious disease that has caused an overwhelming issue across the world has given us these issues firsthand. We've been able to experience it firsthand, the cost of our healthcare system, the quality of our healthcare system, and specifically the overburden on communities that are already either low income or facing these disproportionate effects. So it's mostly up to health services to handle the altered and increased health burden investing in research that shows the overwhelming effects due to climate change and health. By 2050, there's an estimate of over 100 million internal migrants worldwide, according to the World Bank. Extreme weather events that are more intense and frequent have the potential to obstruct patient and provider access to care, as well as the availability and quality, and to cause significant losses in material, human, and financial resources for health systems. The COVID-19 pandemic, which has revealed how susceptible health systems are, is what is happening right now. A big misconception about climate change is that we have this many years to act, but people fail to recognize that we already need to act because a lot of the consequences are already firsthand seen by many communities around the world, and especially in Africa. A high frequency of infectious and non-communicable diseases, and inability to deliver high-quality basic and specialist treatments, and rising costs have already put a strain on many health systems. It's simply insufficient to close the existing gaps and boost health security performance without taking climate change and variability into account in order to get a health system ready to deal with the effects of the climate catastrophe and guarantee health security for our communities. The ability to manage, protect, and finance population and individual health will be impacted by climate change and variability. Health systems should assess the efficacy of their interventions and systems under various climate circumstances and mediated impacts to increase our capacity for interventive risk management at all levels. So what does this mean? Well, this calls for a deliberate approach, and this is fully dependent on the health system's dedication on developing multi-sectoral and community engagement in order to achieve these shared goals that assess both the climate consequences as well as our public health functions. In order to institutionalize our risk management capacity across public and private institutions, as well as community structures, timely, context-specific, and cross-cutting investments in health systems must be made in accordance to climate impacts, as well as already existing impacts that we face today. And at the same time, they must look into both immediate and long-term opportunities to boost this resilience. And with that, I want to thank you all for taking the time to listen, and especially encourage you to remember these 3 takeaways. In order to address both our health security and our ongoing impacts due to climate change, we must take into consideration climate change's already existing effects and involve young people's voices moving forward, like Africa CDC is doing currently with this pre-conference. And most importantly, uplift our own communities that are facing these first-hand impacts as they are the priority.
Thank you very much, Soila. I think the call to action is very clear. It's urgent, it requires our attention, and it must be a concerted effort. On that note, Soila, we say thank you. Once more, can you? Right about now, we'll move to the next session, and this is going to be a series of group discussions. But before we break into groups, I'd like to invite a prime mover of this gathering, someone whose energy, interest, and this convening today, amongst many other colleagues who've done that as well. Point to many of them, and I have to, of course, very specially recognize Dr. Promise Chris Kaniki. Dr. Kaniki is a senior technical officer for strategic programs at the office of the director at the Africa CDC. Somebody says, Chief what? Chief Bingwa. Over to you, Chris.
Thank you so much, Sanusi, and good afternoon, everyone. Good afternoon, everyone. Are you not happy to? I can go back to my seat if you don't want. Okay. I'm very jealous. My session, there's no one coming to sit there. There's no panelist for this session. Can you have it projected? Yes. So this session actually, and I'm happy because during the lunch, we're sitting at a table with a friend who was asking me why I'm not like bringing more interaction with the participant. My friend from Liberia. Oh yes, is here. So this is what you're going to do now. This session is going to have more interaction with all the participants in the group, in the hall actually. And actually, this session is not about us here talking again to you. It's now engaging everyone in the room to try to contribute to what we want to achieve here. And we are coming up with a 6 group, as you can see on the agenda. Next slide, please. Next slide, please. Okay, when it's coming. Yes, the objective of what you're going to do in the groups, as you can see, is we want all of us here to contribute. And we talked about it in the morning. I remember when His Excellency Dr. Sabine talked about engagement, even my colleague Shingai, I mean, all the panelists. If we try to summarize what they talked about is how we are going to contribute ourselves as young people to this to the advancing the new public health order in Africa. And this group, this session, I mean, this is what you're going to contribute to develop our continental strategy for youth engagement in public health in Africa. And the focus, as you can see, is to improve our knowledge, attitude, skills, and behavior. And again, we try to insist on this meaningful participation in public health at all levels. So we are going to divide ourselves into groups. And next slide, please. Next one. Before we scan. Okay. These are the 6 groups. I want everyone to look at the 6 groups and identify which one do you think that if I ask you the question, as young people, as a young person in this room, what is the group that you'd like to join and bring your contribution in terms of meaningful participation of young people to achieve the new public health order in Africa? Are we all together? Are we all together? Okay, thank you. Public health policy, I mean, everyone can identify his group, right? Hello? I'm talking to my friend here. Are we together? Ah, now yes. Which group are you in? Community engagement. Why community engagement? That would be the question in the group. I just wanted to make sure that you have your group. Okay, the previous slide. Oh, I wanted to maybe make it easy. I'm seeing that we have 6 lines. Instead of moving people around, can I propose that like each line represent a group, or you prefer to go in your group as per your choice? Sorry? Line or choice? Okay, line. Who wants line? We are very many, but few. Okay, I think we are going by choice. It's better because we need everyone according to knowledge to contribute meaningfully in the group. So we are going with the group. So you can scan this and choose your group. And then I think after that, we can try to meet, have like 6 groups and discuss. Yes, I'm going there. So in this, we'll be having some leaders for each group. When I mean leaders, just to coordinate, what you are going to do in each group. I'm doing things like politician now. My papers coming from the pocket. Group 1, Dr. Uma. I just speak in the, yes, in the, those who are choose public health policy. No, group 1. Group 1 is not public health research. It's policy. Can you please project the groups? Silas. Oh, okay. Public health policy. Group 1, Uma, you are leading, coordinating the discussion. Group 2, Uma. There's Umar and Uma. UMAR, that's you. OUMA, that's Uma. Yes, Uma is there. Uma for public health research, right? John Bosco and Yaya for community engagement. Yaya, please, thank you. My friend from Ghana. Yes, please. And Na. Where's Na? Na? Yes. Technology and innovation. Faith, Nekabarin Fee. Can you please send again? Not, yes, please. Group 5, public health, workforce, education, and capacity development. Thank you. And the last one will be with Dr. Landry. Thank you for coming back on time. Dr. Landry will be leading the group 6, planning and F economy. So we all know our leaders, right? Can you now go into groups? Yes, we are taking, I think, 30 minutes, 45. And then after we are coming back for our in plenary to discuss what to be. Oh, first, sorry. I think I didn't say what exactly we are going to do. So for each group, for example, public health policy. This group, what you are going to do is to analyze the role of young people, the role that you can play in public health policy formulation and decision making. And this will be like at continental level, but national and also community level. As young people in this group, what could be our contribution? Which role can you play? And I think I'll share this document just to gain time. What could be the approach to implement, monitor, and also evaluate youth participation in policy formulation and decision-making processes? I'm just giving kind of summary for each group. I will share the document. Group 2 is to explore and suggest innovative way of ensuring meaningful youth participation in systematic public health investigation. And here we are trying to focus on scientific study of issues affecting young people who are living through, affecting young people's life. Group 3, we are trying to assess the role of young people. We know that young people are playing a huge role in supporting our community at community level in public health. So we're trying to assess that and what is the role they are playing at that level, and we are trying to focus on how we can reduce the inequality and improve social justice and benefit for young people who are servicing in that group. Group 4, technology and innovation. Here we are trying to deliberate on how to harness social innovation by and for youth to improve public health in Africa. Group 5, we are looking at reflect on the challenge that affects young people, participation as young professional wherever they are into public health workforce, including inaccessibility or tokenism. Oh, I like this. I remember this when I'm talking about tokenism. Group 6, we are looking at reflect on the role of young people that they can play in ensuring effective planning and health economy in public health. So this is just a summary of what each group is going to do during our discussion. We share the document with the leaders of each group, and then we can divide ourselves into this group, come up with our contribution. And again, as I say, for this session, it's our contribution we are going to discuss as in the plenary with the leaders of the group who are going to report your work. And this will be also your contribution to what you're going to come up with outcome of this youth pre-conference. So please make sure that you are really contributing in the group discussion. Any question? Comment? Yes, Dr. Andre.
Thank you so much, Promise. Just 2 points. The first one is, how do you want us to report? Is there a template that we can use to capture the discussion? Encourage us to nominate a rapporteur who is going to speak on behalf of the group members. I feel that this is their time. I don't want to be the one taking the stage. Thank you.
Thank you so much. I will start with the last point. Yes, the group is free to nominate the rapporteur. For the same, for you are free to come up with the idea how you're going to present it. We don't want to guide in how you're going to present. We want everyone like to contribute from what they know and understand for the groups. So please feel free and contribute. And this is where we want to, isn't it, my friend? We wanted us to contribute, everyone. And this is the time. So please, let's now, and we have 45 minutes. Thank you, Sanusi, and over.
Thank you very much, Dr. Chris. So let's go into our groups. Group youth and health policy. That's group 1. Who is the lead for that group? It's you. So please, for colleagues who want to join the youth and health policy, please stand up so they can see you. That you come to the gentleman here. Youth and health policy. That's your man. The second group is public health research. Public health research is led by who? Yes, Uma. So please, Uma is your guy for the public health research. So please, let's do that. Let's do that now. Health policy that way, research that way. Community engagement is who? Yeah. Yes, yeah, and John Bertrand. Yes, community engagement. Yeah is your man. Yeah, and John Bertrand, please wave your hand. Wave. That table, community engagement. Technology and innovation. That's Faith Infi. Technology and innovation is on this table. Oh, sorry. Technology and innovation is at the back. Nah, yes, sorry. So that is technology and innovation. Workforce, education and capacity development is of course Faith. Next is Dr. Landry. Planning and health economics is here. You know what I want to suggest? Maybe you move to this table because you're close to them. Yes. So we have youth and health policy on this side of the table. We have health economics on this side of the table. You know what I suggest? Maybe you move to that end because you're close to them. So your discussion might be interfering. Yeah. So workforce capacity development is on this side. Yeah, just take one. Yeah. That's good. I like the numbers we are seeing in the group. Community engagement is indeed the community. Very well named group. This is tech and innovation. Yes. And this is public health research. Super. Please decide your rapporteurs, and in each of your groups, in terms of reporting, it would be nice to have something concise. What is the main issue you're addressing? What are the emerging trends? What are the challenges? And most importantly, what would you want to see in terms of change? Maybe that the African Union should do, or maybe governments should do. So in that order, is that clear? The general one, the first one is the state of play. What is the general situation? Second one is what are the emerging trends? Third is what are the challenges? And more importantly, what are the suggestions or recommendations that you want the African Union, Africa CDC, or governments, or young people or organizations to do? Thank you. At exactly 4 o'clock, we will come back to the groups so that we can go back to plenary.
you.